Meanwhile, the death of Michael Jackson has sparked a different kind of medical discussion. Investigators say a drug called Diprovan may have caused his death. While its use is considered controversial by some, several local doctors say it has very important purpose. Robin Wilhoit has a closer look in today's Newsmaker segment. Robin?
April, thanks so much. That's right. I'm joined by Dr. Bergein Overholt of Gastrointestinal Associates of Knoxville. Dr. Overholt, good to see you. Thanks so much for being here. We're, of course, talking about the drug Diprovan, also known as Propofol. Correct?
Propofol,
okay.
Yes.
It has been mentioned, and here we see it right here on the screen. It has been mentioned as a possible cause of pop star Michael Jackson's death. First of all, to educate our viewers, what is this drug? What's the purpose of this drug?
Propofol is a marvelous drug that's used in the operating rooms within hospitals and ambulatory surgery centers to produce anesthesia. It's a deep sedative hypnotic, and when administered by trained professional personnel, and that's very key, such as anesthesiologists or CRNAs, it's very safe, very effective drug for anesthesia.
But when it's in the hands of those who aren't trained, I could only imagine this can be a very dangerous drug.
But you're correct. If it is used in an improper setting outside of a hospital or ambulatory surgery center, or by people who are not trained in advanced cardiac life support or airway management, such as anesthesia people are, it can have devastating consequences. The window of opportunity with Propofol, this amount is perfect for anesthesia, but just this amount produces, it will stop the breathing. That builds up carbon dioxide in the system, leads to heart arrhythmias, heart standstill, and that can be devastating.
Most definitely devastating is for sure. And so often people are searching for sleep, but this is not an answer to the sleep we were talking before, the sleep that people need. This is not going to give you that good REM.
It does not give you a good rest like that. It's an anesthetic for anesthesia purposes. For the purpose of trying to put somebody to sleep for deep sleep at night, it makes zero sense.
Mm-hmm. And this is not something that myself or others could readily get, I would imagine, you know.
No, it's a medication that's obtained through an ambulatory surgery center or a hospital by prescription, and it's not anything like over-the-counter. Mm-hmm. This is a wonderful drug, but it can have devastating consequences if misused.
Certainly, and just to make that point, it's unfortunate. You don't want it to get a bad rap, because no doubt there are wonderful, as you've mentioned, uses for this drug, necessary uses.
We use this 100% of the time in our ambulatory surgery center. Patients are sedated, they go to sleep very quickly, they have no pain for the procedure, they wake up immediately within minutes after it's over, and they fully understand, recognize, and remember. There's no vomiting after the procedure. It's just a marvelous drug when used by trained personnel.
And that is the point we have to continue to make here.
Correct.
Dr. Overholt, thanks so much for educating us on this drug. Obviously, a valuable drug in the right hands.
Thank you, Robin.
Thank you. It's a pleasure. Stay with us. We'll be right back.